Hello everyone, my name is Talia and here is my audience. Today I'm going to be talking about why healthcare should be free. Healthcare should be treated as a basic necessity, not a reserved privilege for people who can simply afford it. As we all know, in the US, healthcare is very, very expensive. Imagine having a sharp pain in your chest and not being able to go to the doctor. Imagine your little baby being sick with the stomach flu and you simply can't afford to take them to the hospital because you will be behind in hospital visits due to how outrageous this expense is. I want you to think about that because that is something that Americans think about every single day. The trouble of emergency and hospital visits, the debt, and everything that comes with. Today, I'm going to be talking about why healthcare is a basic need, why financial barriers matter in the healthcare system. And my argument is that universal healthcare can improve health throughout Americans and reduce financial stress. This still allows the society to debate how the system should be funded and managed. So we'll be talking about why healthcare should be free, and we'll also investigate the opposing viewpoints. I believe that healthcare should not depend on income. Healthcare is a basic civil liberty right that everyone should have access to. We should not feel scared to go to the hospital just because we'll end up in debt. The problem is that people cannot afford care. If people cannot afford care, they often postpone or go without it. What happens when someone has a disease and contracts a disease and they can't solve that problem because they just simply cannot afford it? If they can't do that, the diseases will spread, hindering a wavering amount of people becoming infected, and this affects our entire nation, not just a few certain people who cannot afford it. The principle is that this is a medical need, it's a serious issue, and it should not depend on a person's income. The US system should not have a say when or where we can receive essential care. Universal health coverage means that all people have access to health services they need without financial hardship, according to Wong in 2015. I'd also like to note that these are 3 sources, 2 being from the CSN database, helping my view, and 1 being from the CSN database, opposing my view, which we will also get into on this next slide. For argument number 2, universal healthcare can improve access. If we get earlier care, we'll limit diseases, we'll limit problems that start off as little and become bigger. Often we could just solve something for $10, but we don't because we simply can't afford it, and it leads to a bigger problem. The earlier care, people are more likely to seek preventive and routine care before problems become emergencies, costing the nation a heavy amount of financial stress. This also leads to less financial fear. Universal coverage can reduce the risk that a medical problem because of financial crisis. The realistic policy goal here is that research has examined universal healthcare as possible direction for the United States. The benefit is that our system will build around access and make healthcare more equitable. This is meaning that people who oppose this viewpoint need to realize that the earlier care, the better, and the healthier our entire nation will become. The opposing view. Critics like to argue that healthcare is not necessarily a government-provided right, meaning why should our taxes have to go to something that is not the government's problem? It's our own problem because it is our health. This is because providing services require resources and may limit individual freedoms, such as, what it comes down to in the end, is money. Why this matters, these concerns should be considered when designing a universal system that coverage is sustainable and reasonably managed. So, in the end, opposing viewpoints, they feel like they shouldn't have to pay more taxes. However, researchers have also seen that universal coverage actually limits our costs. If we had universal healthcare, it would significantly reduce the 17.8% GDP that comes from it. But others may argue that that is not true. However, researchers have found this to be true, that universal healthcare would limit our 17.8% GDP to around 10% or lower. Universal does not mean unlimited. It means that a system can provide access to essential care while still using budgets, rules, and planning. We still will have, this won't mean that the hospitals will fill up. That's what our opposing viewpoints, they think that the hospitals will fill up, that we won't have much access, that it'll just be chaotic. However, I would like to note that we will still have budgets, we will still have plans in place, and everything won't be as chaotic as they may seem. The key question, should someone be denied the necessary treatment solely because they cannot afford it? Is that the system that we are living in the US, that we can't even take our children to the hospital because we cannot afford it? So what are we gonna do for those living in poverty? The government, Medicaid, they do not fund every single thing of our health benefits. My response, concerns about cost and government involvement are legitimate. The concerns are real and it's there. However, they can be addressed through policy design and through our politicians and our government. They do not erase the need for people to receive essential medical care. My position is stronger because everyone needs care, not just people who can afford it. Access can prevent crisis. We can limit diseases. We can limit cancer. We can limit everything by being treated on the spot as soon as we feel something is wrong with our body, instead of waiting until the last second. Financial barriers hurt. Often people stay with jobs just because of their insurance policies. They stay somewhere that they do not like because they have a good financial insurance plan at their job. Our needs should come first. Access should always be there, and it should not be a question. That is our human right. My conclusion, my position here is that healthcare should be available to everyone, regardless of income. My reasoning is because universal access, like I said, it can reduce financial barriers and improve the ability of care. Healthcare should be based on the medical need, not the ability to pay. Here are my 3 scholarly journals works cited page, one being Bradley Andrew, Positive Rights, Negative Rights in Healthcare, Rashford Margaret, A Universal Healthcare System, Is It Right for the United States? And Wong Joseph, Achieving Universal Health Coverage by the World Health Organization.